Hey everybody, Dr. Michael with Valiant Physical Therapy, where I specialize in working with runners here in Evanston, Illinois. I want to talk about a patient that I was working with yesterday who is coming out of some degree of an IT band syndrome, and we had been trying to build her up into a consistent routine of running over the past few months, but honestly, due to work and the weather not being that great, she really wasn't getting in a consistent routine. She would have random mile, 2 mile runs kind of sprinkled out around the place. And she recently went on a 3.5 mile run outside with a colleague, and things felt fine. She's like, hey, my IT band didn't bother me. I feel fine, right? So then she started to tell me how there was an opportunity for her to go on a 7 mile run with her colleagues sometime next week, and how she thought that she was gonna. She's like, I'm gonna do that 7 mile run, and I very quickly said, hey, I don't think that that's a very good idea, especially considering the fact that, number one, she hasn't really been consistent with running for months now, and two, the distance is literally twice as long as what she had just ran. And especially when you're making a transition out of being injured or having some sort of time off from running, once you actually build back up into some degree of a consistency with running, then you can start to play around with those longer runs. But to go from not really running very consistently to doing a 3.5 mile run without any pain to then saying, okay, I'm good to go, let me go for that 7 mile run, not really going to be a great idea. Maybe she can tolerate it, but it's not really worth the risk. So one of the things that I recommended to her was, hey, stick to that 2 to 4 mile range. Like, if you can do 3.5 miles and that feels fine, I'm going to invite you to stay within that 2 to 4 mile range and just try to do that a handful of times throughout the week. Do that for a few weeks in a row. Build that consistency with running. Make sure you have a consistent running volume week after week, and then you can start to play around with going on that longer run or adding a day of running or really progressing the volume. So 2 to 4 miles of a run distance 3 times a week is a really good base frequency and base volume for someone who's not really like a super avid runner. Maybe they're coming out of some sort of an injury and they can tolerate 2 to 4 miles. That is really kind of a safe range, at least for her, to kind of stay within. So I advise her, don't do that 7 mile run. If you want to, really what might be a really nice thing to do is from your house, run a mile away from it, turn around, run a mile back. That's an easy 2 mile run. Do that 3 times a week. Do that a few weeks in a row, and then you kind of have yourself a nice solid base, and you can start to play around with progressing the distance and the overall volume from there. So don't make the mistake of doing too much too soon, especially when you're coming out of some degree of a running-related injury or a time off from running. Build that base, build it up slowly over time, and get back to running and have some fun with that. Thank you.